some proper lifting techniques. Now, the proper lifting techniques is a part of the proper body mechanics. So what are the 5 core values of proper body mechanics? First and foremost is to reduce stress and strain on muscles, joints, ligaments, and soft tissues. It conserves energy. It promotes effective, efficient, and safe movement. It maintains proper body control and balance. And it promotes effective, efficient respiratory and cardiopulmonary functions. So these are the core values of the body mechanics. So we're going to do some we're going to apply a body mechanics through lifting. So the key word here for proper lifting techniques are the base of support, what we call is base of support, or the BOS. Now the BOS, which means an area beneath an object or a person that includes every point of contact that the object or person makes with a supporting surface. So in that case, which means an area which fully supports, in layman's term. So so in the lifting techniques, we have several lifting techniques. First and foremost is the deep squat, the power lift, the straight leg, the golfers or the one leg stance, half kneeling, traditional, and the stoop lift. So we got to before we go to a procedure, you need to prepare a patient or by yourself, if that's okay. And before we proceed, we'll have some 2 breathing exercise and counting 1 to 3. So first and foremost, we're going to do some deep squat. As you see it here, we have some items that we're going to do. We're going to do some liftings. Now, first and foremost, again, it's a deep squat. So again, breathing techniques, 2 breathing techniques, and count 1 to 3 before lifting. So this is for the deep squat. So breathe in, breathe out, breathe in, breathe out. Tell your patient to breathe in, breathe out. And after he done his he or she done with his breathing method, now we go now to the counting. So after that, 1 is for the deep squat. Is 1, 2, and 3. Now that's for the deep squat. I'm going to do it again, but in slowly, so you can see it. What I'm doing. Again, this is for the deep squat. Breathe in, breathe out, breathe in, breathe out. Count 1 to 3 for lifting. 1, 2, 3. That's for the deep squat. Now the next thing are we going to do, and by the way, the reason why before we do a procedure, the breathing exercise is to relax the patient, not to cause him any agitation or maybe freak out, just to relax. So after we're done with the deep squat, we're going now to the power lifting. So this is the power lifting. Again, breathe in, breathe out, breathe in, breathe out, and then count 1 to 3 before lifting. This is for the power lift. 1, 2, 3. That's the power lift. You might get confused about the deep squat and the power lift and the traditional, which I'm going to present to you later on. So the deep squat is where you're squatting like this. That's where the deep squat. Your base of gravity, the one that I mentioned, the base of support was your foot. This is for deep squat. Now again, this is for the power lift. You're going to put some momentum on your upper X. And your base of support is still your foot, or your feet, sorry. So this is the power lift. That's about it. Now the next is the straight leg. Now the straight leg, I'm going to present it to you. Okay. So this is for the straight leg. The straight leg, I'm going to present it to you again. Breathing exercise, 2 breathing exercise in order to relax, and then count 1 to 3. So breathe in, breathe out, breathe in, breathe out. 1, 2, 3. That's for a straight leg. Now if I'm going to do it again slowly, you can see what I'm doing. This is actually for a straight leg. See what I'm doing? Now, what I'm doing is when I'm doing this straight leg, my first leg was in the front, while the second leg was in the back. So my first leg was in the base of support. Was I lifting the object? As you can see, my first leg here does all the support. That's for the straight leg. Now the golfers, next thing is the golfers. And the golfers, if you ever watch any golfing videos or any sports videos related to a small ball like baseball, etc., or just a random guy who's just picking up his apples or oranges that fell off his shopping cart, it's very simple. It's very, very common to see that lifting technique. So, find an object. So I'm using my bouncing ball, like this. I'm going to put it on the floor. I'm going to pick it up. I'm going to do some golfer's technique, or what they call is the one leg stance. So here we go. See what I'm doing? Same thing with the straight leg, but the base of support is still my left leg. The right leg over here, I'm just tiptoeing like this. I'm just picking it up. So I'm going to do it again so you can see. That's for the golfers. Again, breathe in, breathe out, breathe in, breathe out, and 1, 2, 3. That's for one leg stance or the golfer's lift. Now the next thing is the half kneeling lift. For the word itself, half kneel, you're going to kneel by half again. So same procedure, count 1 to 3. Breathing exercise, 2 breathing exercise, and count 1 to 3. So this is for the half kneel. Breathe in, breathe out, breathe in, relax, breathe out, and then count 1 to 3. 1, 2, 3. Now that's for the half kneeling. Now I'm going to do it again very slowly so you can see. Again, breathe in, breathe out, breathe in, breathe out. Count 1 to 3. 1, 2, 3. Now, what you can see is my knee, my right knee is my base of support. I'm using my left leg as a support also. It's kind of more like a half base of support. And I'm gaining momentum on my left leg as he carries on the weight of the object. So this is what I'm doing. Now that's for the half kneeling. The next thing is what we call the traditional lift, or just an ordinary lift. You might get confused about the deep squat and the power lift. The deep squat requires squatting, while the power lift, it may require a little bit of squatting, but your upper X does all the job by lifting. Now this is for the traditional lift. So again, count 1 to 3. 1. I don't know. Breathing exercise. No, sorry. Pardon. Breathing exercise. 2 breathing exercise in order to relax. Breathe in. Breathe out. Breathe in. Breathe out. Count 1 to 3. 1, 2, 3. Oh wait. That's about it. You're just lifting. Again, we're going to do it slowly so you could see. Count, breathe in, breathe out, breathing exercise. Breathe in, breathe out. Breathe in, breathe out. Count 1 to 3. 1, 2, 3. That's it. Now, I'm going to demonstrate to you again about the deep squat, the power lift, and traditional lift. If you might get confused about that, this is for the deep squat. The deep squat requires squatting. Like this. Like a sumo preparing for a fight. This is for the deep squat. This is for the power lift. I'm using my upper X as for lifting, and this is for traditional. That's for traditional. Now the last thing is the stoop lift. Now the stoop lift, you may require some basket or bags or any item. Put it on the side. Again, count 1 to 3. 1, 2. Breathing exercise, and then count 1 to 3. Again, I'm sorry, pardon. Breathing exercise. And count 1 to 3. 1, 2, 3. That's it. That's about it. That's the stoop lift. I'm going to do it again so you can see it slowly. Okay. Breathing exercise. Count 1 to 3. 1, 2, 3. And that's it. The reason why I'm just only bending my knees, but I'm picking up an object, I'm lifting my object on the side. Right? That's for the stoop lift. Now, for having having also for the body mechanics or proper lifting techniques, it's for the increasing the joint mobility. Not having the improper body techniques or lifting techniques, lifting techniques on a proper body mechanics can cause many problems, such as the main problems were shoulder, some neck, and maybe some leg pain. So that's the major problems of having improper lifting techniques with improper body mechanics. So I thank you all again for watching this video, and I'll present you to another presenter. Thank you very much.
A transfer is the safe movement of a person from one surface or location to another, or from one position to another. Depending on the mental and physical ability of the patient, a transfer may be performed either independently, with assistance, minimal, moderate, maximal, or standby supervision, or dependently. A variety of terms are used for transfer assistance. Adjusting the patient's position and bed mobility activities are included in the broad definition of a transfer. The ability to move upward, downward, or side to side, and the ability to roll turn over, and move a sitting position from recumbent position are important activities for a patient to be able to accomplish for independence. Planning and organization are required before patient attempts to perform any transfer. The patient should be informed about the transfer and taught how to assist with or perform the maneuver before attempting it. A demonstration of the activity by another patient or by the caregiver may help the patient learn how to perform the transfer. You will need to prepare the patient, the environment, yourself, or possibly other persons before performing a transfer activity. Initially, you should review the medical record and interview the patient for information and help you plan the activity. Preparations for transfer. Check the patient's charts for precautions such as weight-bearing status for surgical procedure, orders, joint disease, or osteoporosis. Also, plan the transfer across the shortest distance. Plan to move the patient toward his or her strongest side and assist the weaker side. Obtain necessary equipment or assistance if needed. Ensure the patient is properly dressed for the transfer excessively loose clothing, long trousers, slacks, or pajamas should be avoided. Special precautions. Look for the patient if the patient has a total hip replacement, low back trauma or discomfort, spinal cord injury, burns, or hemiplegia. One of the bed mobility activities are side-to-side movement while the patient is on the supine position. In order to do this activity, your forearm should be on the back of the patient and your other forearm should be on the upper back of the patient. And gently pull towards you. Next one is your forearm should be on the lower back of the patient and your other forearm should be on the hip of the patient. And last one is your forearm should be on the thigh of the patient and your other forearm should be on the heel of your patient. The other bed mobility activity are moving your patient on the downward motion. In order to do this activity, make sure your patient is on the hook-lying position. And grab the hip of the patient and pull it towards you. The other optional bed mobility activities while moving your patients on downward position is put a piece of cloth or towel on the hip of the patients. And in order to do this activity, make sure your patient is on the hook-lying position. And put the cloth or the piece of towel underneath the hip of the patient. And gently pull it towards you. The next bed mobility activities are moving your patient on the supine position to side-lying position. If you're moving your patient on the left side, make sure his left hand is underneath his hips. And the right hand of the patient must be on his chest. And grab the upper back of the patient in his hips and gently pull it towards you. The next bed mobility activity are moving your patient from the supine position to prone position. In order to do this activity, his left hand must be underneath his hips. And his right hand must be on his chest. And grab the upper back of the patient and the hip of the patient. While on the side lying position, put your patient's hand behind on his ear and gently put the patient on the prone position. The next bed mobility activity is moving your patient from supine to sitting position. This activity, it involves patient's head. In order to do this activity, ask your patient to hook your elbow against his elbow, and also ask the patient to push his other hand against the bed and grab the patient's thigh and count to 1 to 3 so the patient will know. And 1, 2, 3, and gently raise the patient. The last bed mobility activity is helping your patient to move upward and downward. In order to do this activity, make sure your patient is on the hook lying position. And ask your patient to move upward. 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 The next one is on the downward movement. Make sure it's on the hook lying position. And grab the hip of the patient. And
Hello and good day everyone. I am Aaron Venerante, BSPT1 from Calamba campus. I am here today to show you how to drape in sitting position, prone position, side-lying position, and supine position. I hope you like the video. Thank you. In supine position, a pillow may be placed under the patient's head and also a pillow placed behind the knees of the patient to provide comfort. Make sure that the patient's upper extremity is parallel with the lower extremities. In supine position, the patient's upper extremity can be exposed for the treatment. Also, in supine position, the lower extremity can be exposed for the treatment too. In prone position, the patient must be facing the bed and the pillow placed under the face of the patient. A pillow can also be placed under the patient's chest to provide comfort and to avoid contracture. Also, you can place a pillow in the hips of the patient, whatever he desires for comfort. In this position, the back of the patient can be exposed for the treatment. side-lying position, the patient must be side-lying and the pillow placed under the patient's head, a pillow placed on his arm, and the pillow placed between his knees. This pillow is placed to provide comfort and to avoid contracture. In this position, the side part of the body can be exposed for the treatment. In sitting position, a pillow can be placed behind the patient or it can be placed in a flat area where the patient head is. This is to provide comfort and to avoid contracture. In this position, the back of the patient can be exposed for the treatment. So what is draping? Draping is to expose or to free an area to be treated, address modesty concerns, maintain comfortable body temperature, and to protect the skin and clothing from becoming soiled or damaged.